number, and I want to go to Dr. Stephen Wu. He is the Pediatrics representative for the Australian Medical Association here in WA. Dr. Wu, good morning.
Good morning. Can you hear me okay?
Loud and clear. So that 2-year wait list, is that still too long?
Oh, absolutely. I really worry about the children and families that are waiting. When children wait 2 years, that means 2 years of delayed diagnosis, and that from a human element means avoidable hospital visits for many. It also, for those with developmental problems, means delayed therapy, delayed school support. It creates enormous stresses on the families that are out there, particularly with developmental issues, which was mentioned. It's far too long. As many of your listeners are probably aware, early intervention makes a major difference for very little ones. And we do have a very tight window in early life where therapy is more effective. So it would be nice to see those kids a lot earlier.
And so what happens when a child can't access that specialist care or get to a paediatrician? What are the risks there when we're talking about developmental delays?
I think there's a down-the-track cost, because if we can do interventions a lot earlier and provide support at a much earlier time, the outcomes are better in terms of their educational outcomes, their social well-being, particularly in school, and academically and emotionally. I think these kids fall behind if they're not seen sooner.
And what about the pressure on families, parents in particular?
Oh, absolutely. I think the stresses on the families, especially given that there's cost of living crises and there's a lot of stress out there for very young families, adding to that extra stress can have a huge toll.
My guest this morning is Dr. Stephen Wu. He's the Pediatrics Spokesperson for the AMA here in WA, and I do want to know from you and hear from you if you are somebody who is waiting to see a paediatrician in the public health system for your child. Tell me what that wait is like and you know, how difficult it is waiting. I want to know how long you're waiting for and the pressure that's putting on your family and the concerns, I guess, that you have for your children. And what we're trying to understand is what is behind these wait times, because they've been stubbornly high for quite a few years now. What's the problem here?
I think the core problem is a workforce shortage. And that's not just developmental pediatrics, but a lot of the other subspecialist pediatricians as well, and that includes surgeons. Fixing it does need a coordinated plan. We need to train more. We need to retain more of the people that we train. And I think we need to get a bit smarter about using team-based care, particularly community teams as well as telehealth. So there's a lot of workforce pressure there at the moment, and I think we're playing catch-up.
How long does it take to train someone like you, a paediatrician?
It takes a long time. I think if we talk about me specifically, it took 10 years to train someone like me, and that doesn't include medical school. There's usually 5-6 years of medical school prior to that. So by the time I qualified as a consultant, I've been in training for 15 years. So the pipeline is really long, and that makes it really hard when we react late, because the training pathways are
so long. So we should have been onto this 10 years ago.
Oh, absolutely. I think your listeners are probably aware that child development was struggling for a long period of time, and I think if you really look at it, it was 14 years before they got an uplift in funding in 2024. So even with that additional funding, it's not easy to fill those gaps if there's been a gap in funding to fill earlier.
So this is not an instant fix?
No, we do need long-term planning around this. If we react and do short-term fixes, we're always on the back foot.
So how do you do that long-term planning? What do governments need to do?
There's a need to have long-term vision around this. We need more training positions, particularly in areas where the wait times are longer. We do need more developmental paediatricians specifically. We also need to keep in mind that the clinicians out there are holding heavy caseloads. And what that means is there's a risk of burnout. And if that starts to occur, you start to worry about risking people leaving the system and leaving for other jurisdictions. So there has to be a thought around rationalising people's caseloads as well.
My guest this morning is Dr. Stephen Wu. He is the Pediatrics Spokesperson for the AMA, Australian Medical Association here in WA. I would love to hear from you this morning if you are caught in this and waiting to see a paediatrician for whatever reason. I've got time to take your calls, 1300 22 1025. What about regional areas? I mean, we are broadcasting across the state. I suspect the situation is even more dire there.
I think there's more workforce pressure that's unique to WA because of that geographic isolation. So they are a concern as well on how to provide better services to them. I think for regional areas, we can probably get a bit clever about telehealth, but they do need paediatricians on the ground and access to developmental paediatricians face-to-face.
And then you've got to attract the doctors there, the paediatricians to regional areas. I mean, how do you do that?
I think if child development, you can do outreaches in terms of outreach clinic from metro areas, but you do need a larger workforce to do that.
What about international doctors? Are they part of the solution?
They are, but you have to keep in mind that we are competing in WA with every other state and internationally for a very small pool of specialists. And demand has grown faster across the country, and the training pipelines are not too small. So I think also when the training pipelines are small, when we're parachuting in a person that's trained overseas, a lot of things, including development, requires you to know the systems in place to deal with the problems that they're seeing. So they do need upskilling and training as well, and when the training is already limited, it's really difficult to just start with a person from overseas. It's not an easy solution to implement.
So what would help right now? Because we know there are GPs now that can be trained up to do, assist with ADHD diagnosis and treatment. What else would help? Is it more of those sort of allied health teams? You talked about sort of being a more community-based approach. What does that look like?
I think the multidisciplinary approach is the way to go. No paediatrician works in isolation. We do need more psychologists. We need more speech pathologists and OTs. We need better integration into the schools and disability services. Specifically what that looks like, I would hope that we at some point could embed OTs and speech pathologists, for example, into early education pathways in kindies and pre-kindies where they reach out earlier and identify earlier and support. The early educators out there do an amazing job of supporting kids, and they do need help in terms of being upskilled in terms of dealing with these kids as well that are struggling.
Yeah, I wonder if parents like that idea, having OTs and speech pathologists in those early childhood years at schools. I know some schools have them, not all, and I think it's not a luxury that every